Hello everyone, so I'm back. Let's have the continuation of the part 2 for your communication skills in IPE. Alright, so medical records, these are compilation of the patient's documented data on past and present illnesses and treatment written by healthcare professionals. It contains enough data to identify the patient, support the diagnosis or reason of attendance, justify treatment, and accurately document outcomes of treatment. So we have already discussed the importance and the purpose of why we are documenting, no? For the sake of not just legal purposes, but also as a way to have a record of our patient's data, which is important in formulating the right treatment for them. So aside from that, aside from recording facts about the patient's health, it also emphasizes on the events that affects the patient during the current admission. So everything, not just the history, but also the current information regarding your patient is also included in the medical records. So the main use of this one is to document the course of the patient's illness. So you can see the improvement or the progression, kung nagiging severe ba yung kanyang condition, just by looking at or reading the medical records. To communicate between the attending doctors and other healthcare professionals providing care to the patient. For continuing care to the patient, if you are going to endorse the patient to another healthcare provider, this will serve as an endorsement notes. For research, pwede rin itong gamitin for research purposes of a specific disease and treatment. Especially, I think on your third year or fourth year, you'll be having your thesis writing. No? So it's also one way to gather data for your research. Okay, so we have different formats or forms with medical records. No? We have already discussed yung ating 4 types of notes. But we'll specifically discuss pa the formats of documentation, especially specific to rehabilitation. Okay, so the front sheet of your medical record should include the identification of the patient and summary sheet. So identification should have the diagnosis, the name, the disease, and if there are operation codes, and the attending doctor's signature. And then you also have to have the consent for treatment. So meron yung mga waivers signed by the patient or the family's patient. Correspondence and legal documents received about the patient, for example, referral letter, request for information, and etc. Discharge summary, if ever meron, diba? You can also include that under the patient's medical record. Admission notes kung inpatient or acute care, admitted sa hospital yung patient. You should have an admission notes, including the clinical history of the patient. Clinical progress notes, that's also included as part of the discharge summary. Kailangan nandun yung progress report ni patient. Nurse's progress notes, if ever nga naka-admit si patient sa hospital and you're reading the medical record, it should have the nurse's documentations as well. Operation report, if any, kung nag-undergo siya ng surgery. Other healthcare professional notes such as OT, SLP, RadTech, all of the other healthcare professionals that is part of the care for the patient. And other reports such as x-rays, mga ancillary procedures, x-ray, blood works, it should be included in the medical record. So basically, medical records, lahat ng pertinent na mga documents is included in here. Hindi lang siya separately our documents, PT notes, hindi. So it's everything na nangyari or ginawa, procedures, everything that is pertinent to the information of the patient's health is included in the medical record. So, common tong nakikita kapag admitted sa hospital yung patient kasi madaming nagko-collaborate na mga healthcare professionals to provide service to that patient. So, dun nyo siya usually makikita ng medical records. But if it's an outpatient setting wherein we only get to meet the patient during a particular time, so sila yung magvi-visit sa clinic natin, most of the time, the only record that we have is our notes, yung notes lang natin, which is the PT notes. Other notes from other healthcare practitioners, hindi natin siya na-access since they're outpatient naman. So, most of the time, this is common in the inpatient or hospital settings. Okay, so a patient's medical record should provide accurate information on who the patient is and who provided health care. Yan nga. So dapat everyone and anyone who's included as part of the team in taking care of the patient should have the names and the information written there. And make sure na tama yung information, personal information written there of the patient. Kasi when you are going to treat that patient, dun tayo magbabase. Dun sa kanilang name, birthday, and age. No? Yan yung usual na confirmation if tama ba yung patient na pinupuntahan natin. Especially nga if we're treating in an inpatient setting. It should also include what, when, why, and how services are provided, the outcome of care and treatment. Now, let's talk about the formats. Yung part 1 is the types of notes. Now we are going to discuss the types of formats. Okay, formats. We have narrative format, the SOAP format, yung POMR, this is before used before to, pero now it's not as commonly used, no? But I am not sure with the Philippines if we're still using POMR. Nung time ko, we are still using POMR, but references suggest otherwise, no? And then lastly, the functional outcome report format. This one is yung bago. This one is an updated format. Nung time ko naman, this one, it was not yet included. But it has an advantage, this type of format, specifically to rehab practitioners. Let's start first with the SOAP format. So this one is a highly structured format. Major advantage is emphasizing clear, complete, and well-organized report on patients' findings while being natural, brief, and concise without too much use of abbreviations and acronyms. Bakit nila minention to? Because when it comes to using POMR, it's a very thorough way of writing and evaluating your patients, as in all of the systems you will look into. So, for example, cardiopulmonary system, i-assess nyo din yung mag-check kayo ng lungs, function ng lungs niya, mag-auscultate kayo ng heart niya, because you really have to thoroughly assess all of the systems. Even sa abdomen niya, like the digestive system, you're going to do palpation as well. For that's a part of the POMR. But with SOAP, you do not have to do all of those things anymore kasi you're just going to assess what is important to the patient. So it's a more natural and brief way of documenting important information of your patient. Now, this one encourages sequential approach than integrative to clinical decision making. So, isa pa siyang difference, so comparison between the SOAP and the POMR. SOAP, kaya siya tinawag na SOAP because it follows a sequence. S stands for subjective, O is objective, A assessment, and P is for plan. Later on the next slide, we'll have a more definite discussion on this one. And then, aside from that, it has a tendency to simply collect all possible data before assessing it. So, yun nga. So, it's just brief and all of the important information now will be included in the documentation. Okay, so let's have the SOAP. So, S is for subjective. So, this includes this section contains the information received from the patient or caretaker that is relevant to the patient's present condition. So any information that came from the patient's mouth is part of the subjective. So if it's something that came from us, is it included in the subjective? No. So history taking, it's part of subjective because all of the information came from the patient. So example of this one would be chief complaint. So pag tinanong natin siya, why are you here, ma'am? What's the reason? Why did you go to PT? PT clinic. So, pag sumagot siya ng, it's because my hand feels stiff. Ayan, that is a chief complaint. It's been stiff for 2 weeks already. So, that's part of your subjective data or information. Another subjective information would be past medical history or family history. So, if you're going to ask, ma'am, do you have any history in the family of arthritis? Pag sinabi niyang yes. So, that's also included in the subjective information as part of the family history. So, under family history, you'll have arthritis, positive. Tapos, you'll have a follow-up question, which would be, sino po sa parents nyo ang may history ng arthritis? Is it the father side or the mother side? Pag sinabi niyang both side, so you have to write that down. Positive arthritis, both on, usually nakaano to sulat na lang natin yung example. So, kunyari, this is the family history. Yan yung abrev ng family history. So, bulat tayo, arthritis. So, meron dyang mother and father. Or maternal and then paternal. Tapos, we'll just have, pag sinabi niyang both side, we'll put positive. So, ibig sabihin, meron siyang family history ng arthritis on both sides, mother and father side. Pag sinabi niya namang wala, hindi negative yung lalagay natin. we asked so it's still a pertinent information, pero wala daw, so negative. Bakit naging pertinent yung arthritis? Kasi ang complaint ni patient is there is stiffness of the fingers, and usually, diba, kapag mga stiffness, it's a sign of arthritis. No? So you are just confirming baka nga arthritis, no, because may family history siya ng arthritis. So paano naman kapag sa father side lang daw siya? So ba't ko dinalit pa? So, basically, negative yung sa mother and then positive lang yung sa father. So, pag binasa na natin yan, okay, may family history siya ng arthritis sa father side. Paano naman pag personal history? So, when we write it down, this is under subjective pa rin Subjective yan. Subjective. Pag personal history, this is under personal or, I'll delete that one. Past medical history. Past medical history. Ayan. Past medical history meaning ito yung mga history niya. So, for example, tinanong natin siya, ma'am, may history. Do you already have a history of arthritis? So, we asked arthritis also. Pag sinabi niyang, I'm not sure. Pag I'm not sure, usually we write it as unrecalled. Pag sinabi niyang, wala, I've already had doctors, told me na I don't have any I don't have any arthritis, so you write negative. Kung meron, this is another way of writing it. Pag nag-positive naman siya dito, you write it as positive. Tapos tatanungin niyo siya, kailan po kayo na-diagnose ng arthritis? Much better sana if exact date. Pero syempre, we can't expect naman na matatandaan pa nila yung exact date. No? So, sometimes year yung naalala nila. Anong taon po kayo? What year were you diagnosed with arthritis? So, for example, sabi niya, anong 2012? So, you write 2012. Yan. So, positive siya since 2012. Ayan. So, what else? Diabetes, hypertension. So, kunya, tinanong din natin siya, may history po ba kayo ng diabetes, ma'am? So, sulat lang natin, DMS diabetes, no? So, pag sabi niyang wala, negative. Pag meron ulit, tanong niyo ulit kung kailan nag-start. Kailan hindi nag-start? Kailan na-diagnose, no? Kailan niyo po nalaman na meron kayong diabetes? Sabi niya, 2010. So, sulat niyo, positive 2010. Ayan. Nag-undergo po ba ng mga surgery? That's also part of the past medical history. So, this is all under subjective. What about objective? So, this one contains the result of tests and measures that are performed by the therapist. So, lahat ng ginawa natin, lahat ng information na manggagaling sa therapist is under objective. So, mga results, interpretation is also part of that. Interpretation nung test na ginawa natin, but not interpretation of all of the test, no? Kasi that's part of the assessment na. So, this one, observation. So, for example, you ask your patient, sumasakit po yung pumunta daw siya, no, because of the stiffness felt on the fingers. And additional information that came from her is she also mentioned that aside from stiffness, I noticed it's swollen and red. Yun, para siyang nagre-red. It's swollen and there's redness. O, pag galing ulit sa patient nyo, lagay nyo yun. Patient complained or patient reports of, pero complain na lang, chief complaint na lang. Ay, sorry. Delete ko lang to. Patient's chief complaint is stiffness on, kunyari sa left lang daw niya, left fingers with swelling and redness. Now, this is under subjective since this information came from the patient. However, if we do our observation to further confirm this one, under objective na siya. So, how do we confirm this? By observation nga. So, objective natin, kunyari tignan natin yung finger. Sige nga ma'am, I'll do an inspection, no? Under inspection, if there is really redness or swelling. So, pag nag-objective assessment kasi tayo, meron tayong inspection, palpation, percussion, auscultation. Yun yung IPPA. Inspection, palpation, percussion, auscultation. Under inspection, we can inspect if there is actually redness and swelling. No? But more of palpation kasi sa swelling. So, observation muna, inspection is redness. Pag tinignan natin, sige nga ma'am, let me inspect your fingers. For example, red nga siya, ma-red na siya. No? So, we are going to write under inspection, positive redness on, kunyari, kailangan maging specific pa. Is it the dorsum? Is it the palmar? For example, dorsum. On dorsum of the left fingers. Okay? So, lahat ng fingers, sa dorsum niya may redness. So, this is a result of our observation. So, it should be written under objective, not subjective. So, did it clarify or confirm the patient's report? Yes, no, it did. Paano kung walang redness? O, doon natin malalaman na, okay, wala naman pala siyang redness talaga. So, talagang subjective lang siya. That's just a subjective or personal opinion of the patient. But if we are going to verify that using our clinical judgment, wala naman pala talaga. No? So, another example is for the swelling. Pwede itong maging objective under under palpation. Objective din to, palpation, objective assessment to. So, kunyari, we palpated, no, pag palpate, touch natin yan. So, palpate natin, wala namang swelling. So, lagay natin, negative swelling on left fingers. Ayan. Pag nag-positive naman yan, pwede nyong lagay positive swelling on the left finger. So, that's an information that came from the therapist. So, that will be included under objective. Other examples would be results of your manual muscle testing, your ROM measurement, no, na I think will be further discussed to you guys once you reach your PT documentation. No, not just PT documentation, PT assessment na subject. Okay, next, the A, assessment. So, this one contains the reflection of the professional's clinical judgment. So, this is parang we come up with the clinical implications, no? Clinical implications or our interpretations of the results that we took, no, of the results of the test that we made, okay, of tests made by the PT. Okay, ayan. So again, these are the interpretations and the reflection. So once we have all of the findings, tapos we have the results, no? Ano ngayon yung interpretation natin? How do we what will we come up with after receiving all of that or getting all of that results? So example would be the PT diagnosis rehab potential. When we say rehab potential, do you think the potential for this patient to improve is poor, moderate, or high, or likely to improve? Yan yung potential, and then etc. Anything that is that requires decision making, under assessment yan. Plan naman, this includes basically the intervention, the management that you are going to provide to the patient. So example would be the plan of care. So it includes the interventions, yung mga exercises that we will perform, management, ayan, mga managements. Patient instruction, even patient education will come, patient education is part under your plan. Okay. Okay, now we're done with the SOAP. Well, let's proceed now with the functional outcome report. So, sabi ko nga, this is relatively new format. This one focuses on documenting the ability to perform meaningful functional activities rather than isolated conditions or impairments. So, this one focuses on the functional capability of the patient. Okay? So, meaning, example of functions diba, is walking, playing basketball, anything that's functional, basketball, okay? So, it provides rationale or justification for therapy. Bakit natin siya pinaprovide ng therapy? It's because meron siyang problem with function, diba? And physical therapists' goal is to rehabilitate the patient back, no? So that he or she can perform again the functional task that he is having or she is having difficulty with. Okay, next, emphasizes readability by healthcare practitioners that are not familiar with PT jargons. Promotes style of clinical decision-making that begins with functional problems and assess specific impairments that cause activity limitations or participation restrictions. So, we identify the impairments that causes the difficulty in walking. So, kunyari, the patient has, lagyan natin ng difficulty in walking. So, we will now assess bakit hindi siya makapaglakad. So, for example, we have assessed that one of the reasons bakit hindi siya makapaglakad is because there is weakness of the muscle. Kunyari na lang, the knee extensors. Siyempre, pag mahina yung ating knee extensors, mahirapan maglakad yan. So, this is the weakness of the muscle. Sorry, ang gulo na nung PowerPoint, no? This is the impairment. Okay? And then the activity limitation or participation, the activity limitation would be, baguhin ko lang yung color. This one is the activity limitation. Pag sinabi nating participation restriction, yung inability ng patient mag-participate in society. So, kapag mahirap siyang maglakad, no? For example lang, sabi niya, I have difficulty with walking and because of that, I'm unable to go to work. So, going to work is a type of participation to society. So, yung inability, so meaning the participation restriction for this patient is inability to work. Ayan yung participation restriction. So, again, activity limitation is difficulty walking. Impairment would be the weakness of muscle extensors. And then participation restriction is inability to work. This is under your ICF model. I'm not sure if this will be discussed to you on your PT documentation subject. But definitely, this will be discussed to you guys. No? Kasi it's part of our documentation. The ICF model. Alright, so abbreviations, I'll be sending a separate chapter from Quinn book, yung reference natin for the abbreviations. Please read on that kasi it includes the abbreviations that we use in the rehab setting. Kasi nga, we have different medical jargons and even abbreviations, we have different from other healthcare professionals. So, pwedeng yung, ano ba yung example natin? Sometimes, yung CVD, ito ba yun? Wait lang. CVD sa atin sa mga PTs, this could be cerebrovascular disease or stroke. Sa mga doctors, iba yan. Iba yung meaning yan. May ibang condition siguro na may CVD din yung abrev nila. So, it depends, no? So, what I'm saying is that we need to focus more on the rehab abbreviation since rehab naman tayo. Mga PT tayo, hindi tayo doctor. So, use the supplement handout that I will be sending as well. Alright, so now let's have the general principles in documentation. So this is how we write, no? Hopefully we follow these principles when we write na our PT notes, no? So good documentation is a method of communicating with other health professionals, including doctors and other therapists. Especially when we are endorsing our patient, they'll rely on your notes, no? So you have to have an appropriate, accurate, and very legible na documents so as not to cause harm to the patient. Kasi sometimes when we can't understand the word that you wrote there, that could cause us having difficulty giving the appropriate or the right treatment to the patient just because we can't understand what you wrote there, no? So it's also part of the principles, writing legible. And then what else? It should be consistent, no? Consistent and coordinated among the services that are provided by other healthcare practitioners. So this one, it can help, documentation can help us PTs to communicate with other therapists or even other healthcare professionals that can or will provide substitute care for patients if we cannot be there, no, or if we're absent during the session. So you have to make sure that you are writing accurately, no. Alright, ayun, diba? Kakasabi ko lang ng accurately. So, let's start with accuracy. So, this one, do not falsely exaggerate, guess at, or make up data. So, everything that you will write in your PT notes should be accurate, please. Accurate lang siya. Kasi this will serve nga as a legal record. So, anything that you write there is assumed to be the right or the truth, no? So you have to write what is true. Okay, so do not make up informations in your documentations. Avoid incorrect spelling, grammar, and punctuation as it can be misleading. All information should be stated in a factual manner. So even the writing, no, again, it should be in a passive tone when you're writing. So make sure that the manner as well, no, is professional. Next, legibility. So write in a consistent writing style in printed and all capital letters and size. I'm not sure if we are already promoting you guys the use of capital letters. When I was first year, we have been required to write in all capital letters as part of our training in writing or in documenting as we go or as we become physical therapists. No? So, hopefully you guys, you also start practicing writing in all capital letters na so that pagdating nyo sa internship, hindi kayo mahihirapan kasi sanay na kayong mag-all caps. No? So, yan. Write in a consistent writing style. This one, yung picture dito, ito yung hindi natin gusto. No? It's so hard to read. Ano sa tawag dyan? Yung sulat, sulat manok ba yun? Ayan, basta don't practice this one. So for electronic records, consistent font style and size should be implemented. No, depends on the facility. Sometimes you follow a certain format, so you follow that. Okay. So, blank or empty lines. Now, if you have a blank space, you have to put an X mark. Why? This is to prevent other people from writing information on the chart. Kasi nga, it's easy, no, to put out or write in information that are not part of the document. Especially if they had access to your PT notes, pwede na lang isulat doon. Kunyari, gusto ko nilang siraan. No? May therapist na ganun. They want to blackmail you. So, They'll just access your notes and then write down anything there, and that will anything nga that is written in your PT notes are assumed to be the truth. So, kung ano yung nakasulat doon, yun yung paniniwalaan. Wala kang ibang way to justify or to reason out na hindi ikaw yung nagsulat na. So, to prevent that from happening, put an X, no? Para yung X na doon, automatic yon, magsasabi na, no, I did not write that down kasi may X yan. So, somebody else wrote on top of it, diba? And so, this is just to prevent other people from writing information in the chart. Next, timeliness. Also important. No? Notes should be encoded or written at the time of treatment or immediately after, especially with PT notes or your session notes. PT notes or the session notes. Sabi ko nga, diba, some clinic, they require you to submit the documents right after the treatment. Some naman within 24 hours. Sabi ko ata, after 24 hours. It depends pa rin, no? But most of the time, it's within 24 hours, kailangan ma-send mo na. Or hindi ma-send. Ma-submit mo na yung documents or the PT notes, no? At least the PT notes. The IE or the initial eval, most of the time, you're given at least a week to finalize everything before you officially submit it. But the PT notes, it is required that after treatment, you submit it. Okay? So, yan. You have to write the date, no? When you had your treatment session. And kung hindi man nga within the day mo siya na submit, and then you write the day when you submit it. Brevity, no? Brevity means concise and use of exact words in writing or speech, no? Diba sabi nga natin, we need to be simple, straight to the point, and we have to be concise when writing our documents. So, information should be stated concisely, use short, succinct sentences, avoid long-winded statements. It is important to be consistent in writing style to avoid confusion. A brev can help with brevity. However, use of abbreviation should still be limited. Not everything, no, yung buong sentence na ginawa nyo ng abrev. Use only universally accepted medical abbreviation. So, yung universally accepted nga, yun yung sa reference natin, no? We follow that one. Clarity, no? So, this one is the quality of being easily understood. So, kung clear yung mga words mo, it's very simple and very easy to understand. So, clearness of your words or your grammars, your sentences, so that there's malilimit or is a way of preventing miscommunication or misunderstandings with your documents, no? So the wording of all patient care notes should be such that the meaning is immediately clear to the reader. Avoid vague terminology. Okay, and flamboyant words. We don't need that. Hindi naman tayo nagsusulat para maggawa ng essay or poems. So it's okay to use simple words when documenting for patients, no, for medical purposes. So this is an example. Vague siya kapag ROM is increased, no? Kasi anong ROM? Yung ROM, range of motion, pwede nating kunan yan sa lahat ng joints. Pwedeng sa shoulder, sa hip, sa knee, sa finger. So hindi siya specific what part of the body yung kinuhanan ng ROM. Vague din tong patient is feeling better. Ano yung better? Is this with regards to general well-being ba? O better yung sa condition niya, yung low back pain niya before? Does it feel better now? So it has to be more elaborated. But when you elaborate it, keep the words simple. Vague din tong ambulatory with some assist. So ambulatory with some assist. So ano tong assist na yan? Is it assistance from the PT? Assistance using assistive device? So, madami ulit, no, na pwedeng information pa na idagdag dito. Eto. So, how do we, wait, let me just erase this one. How do we revise this one? So, for the first one, magiging clear yan if the right shoulder flexion AROM. AROM means active range of motion is increased or improved to 0 to 70 degrees. So, very specific. Now, simple lang yung sentence but also very specific. Now, if you read it, alam mo kung ano yung shoulder, alam mo kung ilang degrees yung in-improve niya. It's so easy to understand. Next, patient states she knows she is feeling better, indicated by her ability to perform light housekeeping tasks for 2 hours without or after training or tiring. Okay. So, mas specific siya, when does she feel better? What specific type of feeling? Paano niya nasabi na naging better na yung kanyang feeling, no? And it was stated there in the revised one. Lastly, patient is ambulatory with walker, with assistive device, non-weight bearing on the left lower extremity for approximately 20 feet times 2 for 2 minutes with minimal assist. So pag ito, 1 assist, it's coming from the PT na or other caregiver. So it's more clear na kung ano yung assist na sinasabi doon sa initial na documentation. So hopefully you practice this one. So this is going to make communicating and reading your documents as other therapists that is going to treat your patient so much easier. Para mas safe din kami na tama yung ginagawa namin, almost similar to what you are doing. Spelling and grammar. So, wrong spelling and grammar can be equated to lack of communication skill and the lack of professionalism, no? So, be mindful of your grammar. Patient history is used with past tense verbs conjugation since it has already been happened, no? It has already happened, so dapat past tense na siya. If it's not in the past tense verb, assume natin na it still happens, no, or it is still happening. So you have to make sure that the grammar is correct. Okay, next, correcting errors. So correction fluid or tape should not should not be used. No, bawal tayong gumamit ng mga correction tape, liquid erasers, no. Use the medical record as this may indicate an attempt to obliterate information to cover up for malpractice. The proper method of correcting a charting mistake is to put a line through the error, write the date and the initial or signature above the error. So we have an example. So this one is the wrong way of doing it. So nakita nyo, kinross lang nila or nag-use ng correction tape. But instead, ang dapat natin gawin is to put a line through the error and then write your initials and the date kung kailan nyo siya binago. So this one is the correct one. Either your initial or the signature. Ayan. And then you have to provide the date kung kailan nyo siya kinorrect. Okay, next, referring to self and others, use a third-person perspective. When referring to self, use PT rather than I. So PT did, or PT was able to perform ambulatory exercises for 2 minutes with patient. So yun, you don't use I, no? So use third-person perspective. When referring to the patient or client, use patient rather than the pronouns or names. Patient lang. So patient was able to do exercises. Patient reported of improvement of pain. Hindi yung she reported improvement of pain. So don't use pronouns. Just use the word patient. And so this is another example. So this one is the wrong way to write it. I put hot packs on the lower back area times 20 minutes. Instead, we should do this one. PT management includes hot moist pack times 20 minutes on low back area. So that's clearly understood that the therapist did that. Next, authentication. So professionals should sign every entry that makes it into the medical record. All notes should be signed with a legal signature. No nickname should be used. So ano yan, dapat buong name and your post-nominals as well. So, if intern pa, you should write it there, no, na intern. So, kunyari, my full name is Camille Camille Nas. Di pa ako kunyari licensed, no? So, PT intern, batch 2017 ako. And then, sometimes, pati yung school sinusulat, no? DLSM, HSI, ayan. And then, you write the signature. So, signature. Yan. Okay, so that's how you end your document. So, it should be signed every entry. Tapos, if you're still an intern, i-co-sign yan ng PT nyo, ng licensed PT. Alright, so sana excited kayong magsulat kasi you'll get the feel of writing down documents, no? Kasi kailangan ng signature nyo. Ewan ko, nung student ako, I was really excited to do that. Yun yung part lang na excited ako sa documentation, to write my signature at the end of my notes. Anyway, so courtesy. So use a neutral tone when writing entries. Avoid negatively toned entries expressing personal sentiments. So, you have to not sound negative about the report on your patient. So just be professional and simple with courtesy, when writing down your documents. Follow nyo lang yung mga guidelines to sound neutral. Okay, people first language. PT practitioners have an obligation to provide non-judgmental care to all people who need it. So, by putting people first and not their disability, emphasize abilities, not limitations, avoid negative labeling. This is another way to have a neutral tone. Avoid derogatory statements. So, I think we have an example here. This one. So avoid negative labeling such as saying afflicted with, crippled with, victim of, or suffers from. It devalues individuals with disabilities and portray them as more helpless and defined by their capabilities. So instead of that, ang sinusulat natin is hindi siya, 'di ba, dapat yung iba this is an example, autistic person. So, dapat unahin natin, kasi when you read this in this way, parang we emphasize more the disability, no? Nauna pa yung autistic, yung disability niya. But instead, the right, or hindi naman right way, but the better way to write this one is person with autism. O, diba? We still emphasize yung person. Ano lang siya? There's just something unique about the person. So yun, this is the better way of writing it. This one is the incorrect way. Next, objectivity. Avoid personal opinions. Document actual observations of behavior, signs, or symptoms. Anything that is observed and objective. Diba nga sabi natin, let's not be subjective when it comes to documentation, even when interviewing our patients. Use quotation marks when encoding actual statements. So, pwede naman tayong maging subjective, but only if sa patient na subjective information yun ang galing. But subjective information coming from us, that's not allowed. So, if meron mang subjective information that came from the patient, just use quotation marks. Ayan. Abbreviations, no? So, abbreviations, consider who will read the notes. If another health professional will be reading it or non-professional, uncommon abbreviations and jargon should be avoided. But if you know that this is PT notes, no? So ang magbabasa lang din ito ay co-PT mo, so you can use abbreviations that are used in rehab setting. If the writer is in doubt about the use of an abbreviation, it is best to spell out the word. Kung hindi ka sure na universally accepted yung abbreviations na gagamitin mo, wag mo na lang gawin. But rather, just spell out the whole word para hindi maging misleading or hindi magkaroon ng misinformation. That is it. We are now done with your part 2 of communication skills in IPE. So hopefully you've understood, or you have an idea now of the principles and guidelines on how to properly have an effective communication with your patients and your co-workers once you become a licensed practitioner na. So do you have any questions or clarifications? If you have, message me on MS Teams, I'm Camille, or email me. I think the subject coordinator for IPE have given out our emails. regardless, no, I think I'll be posting naman once our topic is up for IPE. So, thank you, everyone. I hope that you have learned something today, and I hope that you will practice the principles and guidelines that I have just discussed with you guys so that you can have an effective, courteous, and respectful way of communicating with not just with your patients but also with your other healthcare professionals that you'll be working with as you become healthcare practitioners in the future. So thank you and good luck. Have a productive week ahead.